want to give a big shout out to you. Your incredible, phenomenal, I guess, advocacy and persistence in organizing today's forum. Forums such as this are extremely important and giving voice to the challenges that are faced by the seniors in our healthcare system. I can't say enough. And John Michael, I know you did provide a little intro to my background. I just want to give a little bit of a highlight on that. I've spent 30 plus years in the healthcare system, and I've worked in public hospitals, mental health facilities, and something like Julie there. I actually worked in Oak Ridge Mental Health facility, which was a maximum security facility for psychiatric patients. I worked at the Queen Street Mental Health Center when they opened their medium security unit. Something that's not in my bio, as a young teenager not too long ago, I actually volunteered at the then Lakeshore Psychiatric Hospital. I used to go in on Saturdays and help patients write letters to family members. It was long before there was the ability for internet. So again, I've had a lengthy history inside the system, but they say that there's really no experience there's no experience like a personal experience. And 5 years ago, I lost my father. And in the process, even though I felt that I was very well adept, I had worked in the system, advocating and navigating for patients and families that would come through my office. I really came up against some roadblocks. My father was involved with Homecare. He was initially in a retirement home, then there was Homecare. He was sent off to a long-term care facility, which I don't believe should have ever happened. He was only there for a matter of 3 days, and then we ended up getting him into a palliative care facility, and it was a horrible experience, which just, again, I guess, my passion, it just sort of increased my passion around that sort of advocacy and navigation on behalf of the patients in our community. As John Frederick said, I have numerous certificates sort of in risk management, patient safety, and I've spoken, I guess, 3 times in the past 2 years at Queen's Park press conferences with respect to ombudsman oversight in healthcare. I really believe that that's something that needs to happen. I also speak regularly at the Ontario Hospital Association and the Ontario Health Information Management Association with regards to advocacy and best practices in dealing with the complaints process. My strong passion regarding the need for navigation and advocacy support in our healthcare system is exactly why I am here today. And I guess it's why iCare Home Health Service developed the iCare Navigator Division. I've been having discussions with Rick Manessa and Tom Allen over the past couple of months, and I really believe that there is a strong need for that. So what does iCare Navigator provide? So we provide support to clients to navigate the healthcare system and explore options. Because of the sort of background and experience that I've had relating to a variety of healthcare resources, when you're in the moment and when families in the moment of the event, it's difficult to step back, so I can be that person that can provide that support to navigate. We advocate for clients to address concerns about their care, and education for clients and their families on specific healthcare laws and regulations. I do hold a certificate in healthcare law, so I very much know the legislation and what can affect care, but also knowing what our clients are entitled to, which they sometimes aren't aware of. With respect to independent oversight, currently, and I know Carolyn, you touched on that, but Ontario's Ombudsman Office does not have jurisdiction to investigate complaints regarding healthcare. There's no independent oversight for patients and their families to turn to when they have complaints about their health care. Again, it's somewhat of a silo process, as Carolyn mentioned, within the CCAC. There's some very good processes that do exist with respect to various agencies and hospitals, but I believe that a strong complaints resolution process is meant to be a neutral, objective resource from which patients and their families can seek advice with regard to concerns. I also believe that there must be openness and honesty and a trusting relationship for the process to be successful in reaching resolution. When staff employed by a healthcare organization are managing the complaints, it can be challenging to remain neutral. And I've been there, I've been in that position. So I know from personal experience that a large number of complaints can and are resolved within the healthcare system. However, as seen frequently in the media, there are cases that require independence from the healthcare system and its staff in order for decisions and outcomes of investigations to be received as fair and credible. Since the launch of iCare Navigator, I've had contact with patients and family members with concerns about care that was being provided. There was an expressed concern, as mentioned here by Carolyn and a number of others, about going forward within the healthcare organization for fear that there would be a negative impact on their ongoing care, and they were at a loss as to how to navigate the healthcare system and how to advocate for the healthcare that was needed. I know, Pearl, you expressed in the media that many seniors think if they criticize the government or bring any issues forward, the services will be cut. You are absolutely correct in stating that that could never happen, as Carolyn has stated as well, that it just won't. I want to speak to a very important point with respect to addressing issues about services. That is the value in being proactive in raising concerns while the care is in process. My rationale, this gives an opportunity to resolve the issue and improve the patient experience. It's next to impossible to make up for care that should have been provided once it is no longer required. I completely understand the fear, and this is an area in which I am again passionate about addressing, and an area in which I assist through the advocacy service at iCare Navigator. I become that independent third party. Ontario's Liberal government, as Carolyn has mentioned, has introduced a bill that will provide for a health ombudsman who would operate inside the Health Quality Ontario, be appointed by and report to the Ministry of Health. I personally do not believe that a health ombudsman appointed by and reporting to the Ministry of Health will achieve what patients and their families are looking for with regard to a neutral, independent third party to listen to their complaints after they've exhausted the internal process within the healthcare system. Again, I really want to speak to the value of how important it is to address something as it's happening. And it can be exhausting for patients, but most often their family members, to try to sort of come up against those walls and argue. In terms of home care providers, I asked the question, how do private healthcare providers, such as Lori Patton has mentioned with Nurse Next Door, iCare Home Health, deliver excellent seamless service, become better integrated with the community care access centers? How do private healthcare providers work better with public healthcare providers? From the start of iCare Home Health Services, there have been discussions with the CCACs about how to become better, become integrated, and I'm sure, Lori, you see that as well. I mean, there's the private home care, but there's no integration at the moment. Care services. So my final point here today is to speak about what I feel is the lack of continuity in patient care. Whether it is from hospital to long-term care facility, hospital to home with CCAC services, hospital to home under the care of a family physician, pertinent healthcare information is not shared in a timely manner, I don't believe. And I guess I say that as well from a personal experience with my father. How can this be addressed? It can be addressed with what I like to call a personal health record. Often patients and their families are not aware that they have a right under Ontario's privacy law to have access to copies of pertinent consultation reports, test results, lab results. This test can be significantly important and affect the continuity of their ongoing care in the community. I know, Carolyn, there's an initiative right now with the Mississauga Halton CCAC and Atrium Health Center to close that gap. I really hope that it does make a difference, but again, there's such a difference amongst the CCACs in the province. So where some CCACs are maybe innovative and coming up with these solutions, but I just know from a family physician perspective, patients feel that these reports get to their family physicians, but they don't. I mean, but it's again the importance of having those records. And I know from certainly when the community care access centers, or certainly when personal private care providers are in the home, that there is a record and there's an ongoing and there's a continuity, but that flow from the hospital to those providers, it just doesn't happen. I also believe that there's a lack of communication between staff providing the services in the home and the public organizations that they work for, as well as the public organizations and the CCACs. Why is it that these types of communication breakdowns are not occurring with private healthcare providers? Again, as previously stated, better integration with the CCACs might assist in addressing the issue with respect to private healthcare providers. I believe that this communication breakdown is a major contributor to complaints about service provision in home care, which needs to be addressed. Communication, I know having worked, like I say, 30 plus years in the area of complaints and addressing complaints, I would say that 90% of the root cause of these complaints comes down to communication. So again, it needs to happen. Thank you, Pearl, for including me on the panel today, and thank you to those who have attended today's forum to share their own experiences. I look forward to discussion which will follow shortly.